in the clinic, it's, you use your insurance. It's what we call fee for service, where
Okay.
you would use your benefits and to provide the services. And the route is all of the above that you mentioned. So it's either people coming in on their own,
Okay.
but definitely primary care, psychiatry,
Yep.
you're right, weight care management,
Yep.
endocrinology, cardiology, ENTs, you name it, they can come from all of those different avenues, because that's where sleep impacts everything.
Mm-hmm.
And so depending on who they're seeing, and that was actually a lot of what we did when we started was, in 2006 and after that, it was really going to all the doctors we could in the community to be able to say, we'll take care of any of your sleep issues. All we do is sleep tagline came from saying, that is all we're going to do. We're not going to steal your patients. We're here to be an adjunct to what you're doing,
Yep.
to enhance what you're doing, to improve outcomes, knowing that what you're dealing with someone who does have high blood pressure or diabetes may be impacted by their sleep, and they're not aware of it or don't have the avenue to know how to address it. And having it all in one spot, because typically with sleep, one of the challenges are you go to multiple different providers for different parts of the sleep piece of it. So it may be you go to your primary care, they give you a referral. Referral may be right for a sleep study or to go to someone.
Okay.
And so now it may take a bit of time to get there. Then you get there, you get your test, and you may go to someone else to get the results. Or what we hear is you may get prescribed with something, you may not have had those results conveyed to you, and then we'll use for sleep apnea, for example. Sleep apnea is when essentially the muscles in your airway close when you sleep at night. People may be aware of the snoring piece of it.
Yes.
Big issue is you're not getting enough air and oxygen. It wakes you up. It causes a lot of issues because of this. And CPAP is typically first-line treatment.
Yeah.
So CPAP is a machine,
Yeah.
and what it does, you wear it when you sleep, and it's forcing just air at enough pressure to stent and keep your airway open.
Okay.
But a lot of times people don't know what it is, and they get this machine dropped off. They don't know why they're supposed to use it, what's going on. And if people don't, one, know why the sleep part matters, what happens when you don't sleep well, what the machine's supposed to do, how am I supposed to use it, what are the issues if I do, all of the things.
Yeah.
And so people then don't start treatment. So when you have it fragmented like that, unfortunately, it leads to people just falling through the cracks. So that was the idea here is we will take care of all of it. We will make sure that, whoever comes in is taken care of, that they're educated as to why it matters, what may be going on, review the treatment results together or the testing results. And then if they do get started on treatment, ensuring that they're successful with their treatment. And if not, figure out why. And again, with sleep issues, unfortunately, a lot of them are chronic. So a lot of times treatment is necessary to be on an ongoing basis.
Okay.
And so you want to make sure so they get the outcomes that they are able to be successful on treatment.